guess. I just start pushing buttons. All right. So let me show you tonight. This course is asking for a sister friend, and we are going to be talking about how to bless your heart. Now, I'm often saying, bless her heart, bless your heart kind of thing, but we're talking about heart from a whole different perspective tonight. All right. So, again, as you're coming in, say hello and let me know you're there. All right. Let me introduce my guest to you. Like, I am so excited. Now, this woman has more letters behind her name than anybody I know. But she is an advanced nurse practitioner. She has a master's of science and an MBA in nursing administration. She is a faith community nurse. She has worked in primary care and acute care with an emphasis on cardiology. She has a passion for health equity and making sure that people in communities, especially those that are underserved, that they have health equity. She's been doing this for a number of years, and I called the American Heart Association, everybody, and asked them who would they recommend to come to my show. And not one person, but two people recommended our guest for tonight. So you already know she's doing a good job as it relates to American Heart Association and heart health for women. She has been volunteering for them for about 15 years. She's a consultant. She's a subject matter expert. She is also an associate minister at Second Baptist Church. And she is the community health liaison there. As you can see, she has a lot going on. But I know now why her favorite scripture is Philippians 4:13, meaning that I can do all things through Christ who strengthens me, because she is doing exactly that. So welcome to the stage, everyone. My guest for tonight, Miss Stephanie Moss. Welcome, Stephanie.
Thank you so much for that warm introduction. And that is truly my favorite scriptures. I can do all things through Christ, because it is Christ that gives me strength. So thank you. Thank you so much for that introduction.
I am so glad you are here. And we have been having this conversation. It has been so rich. We've been talking about it. I mean, I can talk to you for hours, because I'm kind of like a health nerd anyway. I should have been a doctor but actually I started to go to medical school, but I got scared of blood. But don't tell me. Yes. So I switched to psychology. But anyway, enough about me. Let's talk about, how did you even decide that you were going to be a nurse? Tell me a little bit about that.
It's been an amazing journey. Early on, I can tell you. So from the Kansas City area, where I've grown up and my education started, but I have to go back and give homage to my roots. And so we're from a little town in Arkansas called Brinkley, and that's where my mom, my grandmother, grandfather, and everyone had lived for many, many years. And so I was on the phone one time with my grandmother as I was journeying through my nursing program. And we would talk and laugh and talk. And that's one thing about my grandmother. She had a story to tell you, and it was going to be funny. And I noticed my grandmother started to get quiet. And sometimes I would have to listen very well to understand what she was saying because of her dialect. But of course, I listened. And this time I was really listening. And I was thinking, I was like, Grandmother, are you okay? Because I'm not understanding what you're saying. And she got really, really quiet. Well, make a long story short, my grandmother was having a stroke at that time, right as we were on the phone. And phone numbers, phone calls got exchanged. And it was, from what I've been told, it was a nurse in the community that went to check my grandmother's blood pressure. And so fast forward, they got her into a city where she had access and she can get taken care of. But she did have a stroke. And I thought, my goodness, I wanted to learn more. I wanted to do more. I wanted to be that caregiver that were able to provide education and then opportunities for individuals, especially in a rural setting, to have access. And so knowing what I know about nursing, it provides a holistic platform to be able to take care of the whole person. Now, that was my grandmother, but my first nurse that I knew of was my aunt. And so she's still in Arkansas. She's her specialty is with pediatrics, and she was a neonate nurse practitioner. And so I watched her growing up, and I'm like, okay, I want to be like her. I see what she does, and then she comes home and she does the same thing with a lot of love and care. But as she took care of pediatrics, I thought I would stay in my lane and take care of adults, and that's where my expertise lies. So that's kind of my journey to nursing.
Okay, okay. So you have been working you had been working in the area of cardiology. And so what kinds of things were you seeing as you were
So,
focusing on cardiology?
so in the hospital setting, I did learn and become that one nurse that they would call that would float throughout the hospital. And so it was easy for me to really float because most of the time I'd get in 4 hours, and 4 hours I'm gone to another area. And what I was seeing as I was floating, I would start probably with what we call cardiac monitoring, the telemetry
Mhm.
unit. And what I was really seeing was a lot of hypertensive crisis, lots. And by the time I would get things managed there, then it'd be time to go 4 hours, maybe to the ICU. And then that's where I would see really your heart attacks, your strokes, your more acute care people that were really, really ill. And so oftentimes I would go to the emergency room, and in an emergency room, that's when I would see folks that would come in with those symptoms right off the bat. And so that is a lot of what I was seeing, but understanding and getting the skill set to be able to float in different areas to take care of folks from cardiovascular, stroke, neuro, pulmonary, all of that. That is where I got my expertise from.
Okay. So this is Go Red for Women Month, right? We both got on our red, rocking this red lipstick. I love
Mhm.
it. But it's Go Red for Women. And I had posted some statistics that really just literally broke my heart.
Uh-huh.
And especially not just as it relates to women, but some of the things that I saw related to Black women. For instance, one of the things that I saw was that um, cardiovascular disease kills more than 50,000 Black women annually.
Yes, yes. And what's more alarming, if you look at the percentage,
Mhm.
2023, I'll just go back a year or so, that's 58% of Black women more than any other race. 58%. That was 2023. However, the numbers have increased. So we're 2024, it's 60% now. And
Oh,
yeah, you think about why are the numbers going up? We're out here educating. We got all these platforms. We got all this research. We're out in the community, but the numbers are still going up. And then I'd like to share maybe some reasons why that's happening.
oh, okay. Yeah, I can't wait to talk about that.
Yeah.
But so, are we not educating people? What's going on? Do you feel like it's going on that the numbers keep going up? Are we just saying, "Oh well, we can just go to the doctor and get it fixed"? What's going on out there?
So remember, we had a pandemic now back in
Uh,
2020 that
mhm,
just kind of put everybody pretty much on a whole different space about their health.
mhm,
And meaning that if there were health disparities already, if there were lack of access already, if there
mhm,
was racism, if there was socialism,
mhm,
that really was like a catalyst to the stress component that
mhm,
many people, and particularly women, would have. People lost their jobs, people passed away, people died.
mhm.
And so you think about the pandemic, and then we shift out of the pandemic. Now we're running fast forward to try to recover and regroup. So we're getting educated, but oftentimes it's not a priority because we got so many other things that we're trying to do. And then our health takes the back burner again. And so when I mentioned about, social justice or social
Mhm,
injustices, that's the issue. You can be educated all day long, but if you still have environmental
mhm,
collapses, is what I call,
mhm,
or you have risk factors that are not taken care of, like comorbidities, like diabetes, then it's still another catalyst to where women are trying to get their health taken care of, but it is compounded by a lot of those issues already. So,
Wow. Yeah. My guest and I talked about this last week about all the
mhm,
stressors, how
mhm,
it can tend to lead to some of these chronic diseases that we have. And we as Black women deal with a lot of stress, and even African American people, whether it's again the challenges with the healthcare system, not trusting our providers, those kinds of
mhm,
things. But
mhm.
it are our behaviors changing? That's a question I have. Are our behaviors changing to where we I don't know. Work with me on that one.
Okay, so I'm part of a study, doing some
Okay.
research, right?
Mhm.
And it's community-based participatory research.
Okay.
So I do see that our behaviors are changing because it's learned behavior. We're out able to get into the community. When you think about research, you think about being in a lab or being behind
Mhm.
a desk,
Right.
right? And pulling together numbers, pulling together data. But I've been probably over the last 10 years part of community-based participatory research, right? And that's where you get the chance to see people in action based on that particular study. I do think that we're making some lifestyle modification behavior changes, but we got a lot of work to do.
Okay.
Again, those priorities that women have, sometimes the ones that are important take the back burner. And that's why
Mhm.
I talk about sometimes in my settings is having a space for balance,
Okay.
right? Where you can try to meet your needs, be holistic and taking care of mind, body, and spirit. But one of the things that the National Institutes of Health has shared is that perceptions of hopelessness,
Mm.
inequities, we've had social injustices, um, inequities about economics, economic development.
Mhm.
You think about some of the cost of living. I mean, that's a huge stressor. And so
Mhm.
when you're trying to balance out, take care of yourself, and you have all of these catalysts that you're trying to compound, it's definitely hard to prioritize.
Okay. Now let's talk about what's going on in our community. So when we have gatherings at church, and we've been working on this really hard, right? When we have gatherings at church, whether
Mhm.
it's a funeral, a repast, or something, the first thing we pull out is the fried chicken, the macaroni and cheese, and the greens, and my husband uses turkey now, but it used to be a
Okay.
time where he'd have the big old juicy ham hocks in there. What can we do in our communities to kind of change the perception about what is healthy to eat?
Okay, okay. So that was what we consider soul food, right?
Right.
And so
Uh-huh.
it goes deep as to how did we get here, right?
Mm-hmm.
And if Minnie has shared, I know there is a video out there. It's called Soul Food Junkies, and
Oh.
it's been out there for a minute. It's on YouTube, and it just really depicts and shows a documentary of pretty much African Americans, minorities, and
Mm-hmm.
how we had to use the food that was left over from back
Right.
in the
Mm-hmm.
slavery days,
Mm-hmm.
and how they took that food and prepared it and gave it a taste with the salt, with the pepper, with the
Mm-hmm.
fat,
Mm-hmm.
with the oils. And that is really what we've been used to and how we've used to preparing our meals. So what happens is when someone like myself start talking about the factor of salt and sodium and what happens, how it makes the heart works a little harder because where salt is, water follows, right? So bringing those platforms in our, especially in our faith-based areas, because we know that's where the large masses of
Mm-hmm.
minorities are, or especially in the African American church, we bring about a change. And I can remember at Second Baptist, probably about 7, 8 years ago, we started on those healthy diets. We started on exercise. We started on the mind, body, and spirit. So teaching individuals about the amount of sodium that
Mm-hmm.
we should have, the amount, the minimum or the maximum was huge. And so there was a paradigm, but it takes a lot of time and it takes the constant education. And so again, loading things up with sugar, there we go, that precursor that platform for diabetes and loading things up with salt and
Mm-hmm.
sodium, that precursor for a cardiac event or hypertension. And so I just believe it just takes that continued education to raise awareness where we
Mm-hmm.
can do better with our meals, because at the end of the day, soul food is soul food. And I believe that in our culture, we're going to continue with soul food. But I also believe that there is a certain way that we can prepare it that makes us and puts us in a better space for not having those cardiac, events, or diabetes, or sugar diabetes is what they call it. So
Yeah.
I believe that education and how to prepare the meals is a huge factor.
Yeah, I know in my family we always say somebody got the sugar, right? That's
Yeah,
how we used to express it.
yeah.
So so we've talked about heart attacks,
Hmm.
but it seems that strokes tend to be a bigger problem for Black women. Can you talk a little bit about that?
I think that with that kind of go almost hand in hand when you think about
Mhm.
what's happening. And I know we mentioned from a cardiovascular perspective, knowing our numbers, blood pressure, cholesterol. And, I always say I can't talk cardiovascular without talking diabetes, because
Okay.
when you think about it, when you think about the arteries and things of that nature, there's a clog. There's something that's there that's not allowing the blood to flow through. And same thing, same phenomenon, same idea as a stroke. There's a clot, right? And then
Hmm.
when it busts, when it goes through, then that's where the stroke happens. And so we talked about, there's a ischemic stroke, and then there's a hemorrhagic stroke, where there's a bleed on the brain, and then there's a barrier through where blood is not getting through either way. So when it comes to cardiovascular, I always say neuro, cardio, pulmonary.
Hmm.
Cardiovascular disease, you have to consider that if blood pressure is not taken care of, if it's uncontrolled, then that increases high risk for stroke. And so, stroke, of course, as we shared, is one of the most debilitating conditions that anyone can go through. So, when that blood pressure is not under control and there's high risk, and we talked about genetics, then women definitely are high risk for strokes as well.
Wow. So when we think about experiencing a heart attack, let me show you a video of what I thought
Okay.
is a heart attack that
Okay.
women would show, right? That you'd
Yeah.
have chest pains and you could barely breathe, and that's what it would look like if you were having a heart attack. But based on just conversation with you, that's not always the symptom.
Correct, especially for women, right? So that video you showed is almost like an impending doom, right? And
Hmm.
that kind of what is what separates oftentimes when we look at the symptoms from a heart attack, from a male perspective versus a heart attack from a female's perspective. And so let me share a couple things. Increased or just unresolved fatigue
Hmm.
could be a symptom of a heart attack. Nausea, yeah, could be a symptom of a heart attack. Arm pain, either one,
Hmm.
could be a symptom of a heart attack. And then that major abdominal pain could be symptoms of a heart
Wow.
attack.
So
And what I've noted, yeah, over time as well, is back pain.
really.
Yeah. So those are definitely um, more challenging to really realize that's what's going
Hmm.
on unless you seek and get help. Yeah.
Well, and I do have a sister that had a heart attack, and she said the first thing that she experienced was nausea.
Mm-hmm.
And one wouldn't think that was a heart attack. She might have thought she just had food poisoning or something. So
Right.
I really appreciate you sharing those different symptoms, because again, if my arm is just hurting, and again, explain where would it be hurting? Would it be upper? Would it be
It
tingling? Would
could
it
be,
what?
yeah, it could be upper and it could travel,
Okay.
what we call radiating, right? Is it just there or is it movement? So it could be either arm. Yeah.
Wow.
Hmm.
Wow. Yeah. And so I wouldn't have known about those things, or
Right.
just being extremely tired.
Next, yeah,
We experience tiredness all the time, but that's a different level of tired, you would
it
say.
is. Yeah. Yeah, very
Wow.
unusual fatigue is what they're calling it. And so where and a lot of sweating too,
Hmm.
profusely sweating, and you would typically see those things. But again, if you don't know, if you're not educated that these are symptoms of a heart attack, your chances of getting help could be slim because oftentimes we're not prioritizing like, oh, I'll feel better, or
Hmm.
oh, I was just doing something else. But those
Hmm.
are true and real symptoms of heart attack, especially in
Wow.
women.
Wow.
Mhm.
I appreciate that. So again, especially for Black women, there are some risk factors. So I'm gonna show another video, and you can talk through some of these risk factors that
Okay.
we have, and just kind of talk about them because again, if any of these things are in place, you could be at risk. All right,
Absolutely.
let's see what we got here.
So that's, an unhealthy nutrition, that the increased fat, saturated fats, um, there's a big bun there. So you're talking about carbohydrates, just depending on how much the intake is, the lack of physical activity. Research is showing that 150 minutes of physical activity a week is really what's desired to help that heart stay healthy.
Wow.
And then, of course, yeah, obesity, knowing your body mass index, according to your height and weight and things of that nature. And then, yes, smoking increases the risk of heart attack and cardiovascular disease or any type of cardiovascular event. Absolutely.
Okay, let's see.
Genetics. One of the things that we're talking about really, really key now is knowing your family history. And those family reunions are always a good space to talk about, what the history is in regards to cardiovascular disease. Blood pressure, uncontrolled blood pressure. So knowing your numbers is a huge, huge fact. But when your blood pressure is uncontrolled, then that is a high risk, a major risk factor for a cardiac event. And then again, here we are. I talked about diabetes. It's hard to talk about cardiovascular disease and stroke without talking about diabetes. And so knowing the numbers and then really following up with a primary care to help you manage any type of comorbidity is really, really key into managing those risk factors.
Wow. So again, if we're experiencing any of those things, you could be at risk for a cardiovascular event. And it's so important. I love that you share that we need to check out our family histories
Mm-hmm.
because
Mm-hmm.
if we look through the family tree and grandpa had heart disease or our mom had heart disease, somebody had heart disease, we need to make sure that we are going to the doctor, getting our annual checkups, right? and,
Right.
and recognizing any of these things. And if you had to name one thing that a woman could do to improve her health in this area, what would you say that is?
One thing,
Hmm.
the one thing I would say is decreasing stress.
Okay,
Yeah.
I love it. I
Yeah.
love it. What's a good stress buster?
A good exercise.
Okay.
Exercise, a huge stress buster. You got a whole bunch of endorphins going on, you got a whole bunch of hormones that's going on, and then the body is able to just kind of regenerate and reduce any of those toxins that we tend to build up over time. But reducing stress, because you can exercise, you can eat well, you can do a lot of it. But if you're stressed, yeah, it's a mood point. Yeah, it's very difficult to balance.
So I'm going to be pushing. You said 150 minutes is what we need to exercise a week.
150 minutes. So that's 30 minutes a day, 30 minutes, five times, five, like 5 days a week, I should say. Yeah. Yeah.
All right,
150.
I think I'm doing that, and I'll make sure I'll stick with that because it's too much. But I agree with you. It's a great stress buster, and it sounds like also taking that salt off the table and really watching the salt that's in processed foods.
Right, right, right.
There's a lot of salt in processed foods. Okay, Stephanie. So let's talk a little bit about your newest project. I understand you're doing something a little different now.
Yes, actually, this is a different platform for most individuals, and it's IV hydration. And this just gives an opportunity, an integrative opportunity for individuals in their wellness journey. And so when we talk about IV hydration, we talk about the vitamin B complexes, opportunities for people to get boost their immune system, opportunity for people to get revived, not only increase their immune system, but give them a more energy or whatever their wellness journey platform outcomes are. And so we know that we can take vitamins over the counter, as a pill form, but everybody is not in a space where they want to take pills all the time. And so this gives individuals an opportunity, coupled with chronic disease management like hypertension management and diabetes, to be able to have a wellness package, but also have integrative options on their wellness journey.
Wow. So what about somebody who just wants to have more energy? Would that be helpful?
Absolutely. There's a what we call a mix, and there's different nutrients and different depending on what their goals are. So if I want more energy, then there's a mix for that. Or if I want to lose weight, there's a mix for that. And so it really gives an individual, and we give them an educated, informed decision that they can make on which package that they would want to choose to be able to, manage their lifestyle. Yeah,
So you have several different types of things that one can get, right?
absolutely, absolutely. And we just start.
Wow.
Yeah, we start with the minimum, depending if someone doesn't know, or if they say, what, let me just start with trying to increase my energy, so we have an opportunity for them to delve into that package. And if they want to, or decide that they want an advanced therapy, then we have options for those as well. Mhm.
Hmm. Is there one for getting more sleep, getting better sleep?
There probably is one for maybe a restoring, a boost of, I would say, a rejuvenation. I'm not sure about getting more sleep though. They're still using a lot of over the counter melatonin for that. But I think once you start to revitalize and remove some of the toxins, then the sleep pattern gets a little bit better. So,
Wow. So this isn't something that I have even heard about being in our community. And in fact, when my daughter told me about IV hydration, it was something I was scared of. We were in Mexico, and I was hydrated because I had been sick. And
mm-hmm.
she was like, if you don't get better, I'm going to take you down to the IV nutrition place. And I was like, nervous. I'm kind of scared of needles. So, what would you all do to keep me calm to be able to get through this?
It does sound like a lot of anxiety, especially if someone is going to stick a needle in your arm. But think about it. When you're ill, you're going to the hospital, to the emergency room. The first thing that they're doing, just about outside of getting vital signs, is popping some fluids right in there. And so it's
Mhm.
almost the same concept, except for that's on the acute illness side, but we're moving on a wellness journey. And so just really talking through those anxieties, education, things of that nature will really, because we've had individuals with those concerns before, but really just educating and then getting them in a space where they're relaxed. And so that's how we would really counteract some of the anxiety.
Wow, I can't wait to hear more about this. So you are going to be launching this new thing, right? When are you
Right.
going to be launching it? And tell me all about it. Let our listening audience know what you're going to be doing.
Okay, so really, the initiation and the launch was in 2021, right? And so that was the platform. We went live, just a lot of marketing and promoting about IV nutrition and IV therapy. So coming in April, we're going to do a relaunch. And April is Minority Health Month, and so it's just opportune time to really get education out there about IV hydration, coupled with, again, that chronic disease management, like the hypertension, uncontrolled blood pressure. We want to prevent type 2 diabetes. And so there are going to be workshops along with a package deal, which you don't see in too much in the clinical setting, that we'll be able to offer individuals to be able to manage and have a healthier lifestyle, which ultimately increases their quality of life.
Wonderful. So I'm going to show everybody
Okay.
her website, which is www.symbiholistic.health.com. Tell me about the Symbi part. What's
All
that
right.
about?
So Symbi is derived from really symbiosis, right? So
Mhm.
symbiosis is really a platform where you're bringing two entities, two organisms together to have a holistic effect. So coming together as one. And so using that clinical expertise and that knowledge, and using conventional medicine or conventional nursing or conventional health together with integrative options gives you that SIMBI effect. So that is where that SIMBI holistic health came from.
I love it. I love it. So everyone support Stephanie on her new venture. And so I'll actually produce it. Once you give me the dates and
Okay.
everything, then I will make sure that my listening audience knows all about it. And me and my daughter are coming for a visit. We need to get
Good.
more energy. So we are going to come for a visit.
Thank
All
you. Thank
right. So thank you for sharing that information with me. But once again, her website is www.simbiholistic.health.com.
you.
All right.
Yes.
So, gosh, Stephanie, you have been such a wealth of information. I
Thank
already
you.
feel like I have walked away with some tips that can help me to make sure that I am blessing my heart. If anybody
Wonderful.
has any questions out there, put them out there so that we can ask Stephanie while we have her here online. But I really appreciate you taking the time out to talk with me on tonight and to share your expertise. You are definitely an expert in that area. And I see why the American Heart Association says you got to talk to Stephanie Moss, because she knows what she's talking about. And I just
Thank
really
you.
appreciate your investment in wanting to improve the lives of
Yes.
our people, our communities, and making sure they're educated in the things that are going to make them healthier, and so that we can live longer lives. We have enough stress to worry about, but
Absolutely.
at least taking care of our health and having and knowing that there are resources out there like you, I just appreciate it. So
I'm
God
sure.
bless you and thank you so much.
Well,
Any
thank you so
parting
much.
words?
Well,
Any
I would
parting
say,
words?
I would say, parting words would be just know your numbers to begin with. It's a lot of information and a lot to take in, but knowing what your blood pressure is, knowing what your cholesterol is, knowing your BMI, your body mass, height, and weight, and then also getting those wellness checks at your primary care provider, because it's not only the doctors, nurse practitioners are providers too. So I would say start with knowing your numbers and then really go from there as you work with the team. It is a journey for better heart health and ever overall a better quality of life.
Yes. Thank you. Thank you. Thank you. All
Yes.
right.